Mental health and juvenile delinquency. The prevalence of youth in the juvenile justice system with mental health disorders by Tara Gare. The juvenile justice system has 5 main goals, most of which are oriented toward making sure the juvenile becomes a productive citizen. Sometimes accomplishing these goals becomes complicated when mental health disorders are involved. The most common mental health disorders found in juvenile offenders include affective disorder, anxiety disorders, disruptive behavior disorders, substance use disorders, and psychotic disorders. The most commonly recognized affective disorders, also known as mood disorders, are depression and bipolar disorder. Anxiety disorders can include separation anxiety, panic, generalized anxiety, post-traumatic stress disorder, and obsessive compulsive disorder. Conduct disorder, attention deficit hyperactive disorder, also known as ADHD, and oppositional defiance disorder are all disruptive behavior disorders. Substance use disorders are just commonly referred to as drug addiction. And lastly, psychotic disorders. Psychotic disorders are sometimes seen in the juvenile justice system. However, because the symptoms of a psychotic disorder usually do not present themselves until after adolescence, if seen, it's usually in rare early onset cases. So everyone gets anxiety, but an anxiety disorder occurs when fear and worry begin to affect someone's daily life. ADHD is a chronic mental disorder characterized by the presence of multiple symptoms. These include hyperactivity, inability to focus, and a lack of impulse control. It can be categorized based on which symptoms are present into 3 types: hyperactive and impulsive, inattentive, or combined. The prevalence of each type is shown on figure 3 in the slide. Conduct disorder is characterized by a callous disregard for and aggression toward others, from pushing, hitting, and biting in early childhood to bullying, cruelty, and violence in adolescence. Depression is often defined as a feeling of sadness and hopelessness. However, in adolescence, this can sometimes present itself as anger. Lastly, when an individual has 2 or more diagnoses, they are said to have a comorbidity. Multiple studies have found that between 40 and 80% of incarcerated juveniles have at least one diagnosable disorder, with 2 out of 3, so 66%, having 2 or more disorders. It's found that 47% of females and 51% of males have a substance abuse disorder, which is compared to 15% of non-delinquents. Now, remember how I mentioned 40 to 80% of incarcerated youth having a mental disorder? It's estimated only roughly 20% of the adolescent general population has a mental, emotional, or behavioral disorder. So this shows a huge disproportion in the amount of youth who are incarcerated with a mental health disorder as opposed to the relatively small amount diagnosed in the community. Approximately 15 to 30% of incarcerated juveniles have depression, and 1 in 10 are either suicidal or have attempted suicide in their lifetime. 13 to 30% of incarcerated youth have ADHD. Now, this is compared to the 9% the CDC estimates the general population is diagnosed with. 85% of the general population has an increased anxiety. This is believed to be linked to divorce rates, media usage, and focusing on fame and money. It's also important to know that approximately 31%, there was a 31% increase in mental illness diagnoses in children between 2011 and 2017. Now, it's only 6 years, there is a 31% increase. So affective disorders, disruptive behavior disorders, and depression, by the nature of their symptoms, put juveniles who have these disorders at an increased risk for physical aggression. Now, the comorbidity of ADHD and conduct disorder specifically has shown to substantially increase physical misbehavior. Both of these disorders are more prevalent in males and are lifelong conditions. One study, in fact, found that 2/3 of individuals with a conduct disorder eventually had adult arrest records for either a nonviolent or a violent offense. Now, risk factors can include individual, social, or community factors. Individual factors are such as age, characteristics, or even prenatal or perinatal complications. Physical aggression is one of the characteristics that best predict delinquency, sometimes manifesting as early as 2 or 3 years old. As a child grows, if they don't learn how to follow societal rules, they risk being rejected by their peers. And then they become at greater risk for failing school and getting involved in delinquency. As mentioned before, certain mental health disorders and the use of substances also put a juvenile at greater risk of delinquent behavior. And some of the same mental health disorders prevalent in the juvenile justice system often have symptoms of aggressive behavior or lack of impulse control. Social factors involve both family and peer relationships. Family structure is a risk factor for delinquency. Children who are either born into a single-parent family household or those who have parents who've gotten divorced are at a greater risk than children living in a two-parent household. However, this increased risk is lowered slightly based on the primary caretaker, usually the mother's age and socioeconomic level. This is attributed to the lack of stability and lack of supervision in some single-parent and lower-income houses. Children of teenage mothers, especially males, are statistically more likely to become chronic offenders. One study found that males of mothers under 18 were 11 times more likely than males born to mothers over 20 for becoming a chronic offender. Not only is family structure important, but so is the family interaction. Children who come from abusive households were found in 3 different surveys to be at a higher risk for not only becoming a chronic offender, but also for being arrested for a violent crime. Abuse can also result in a higher likelihood of being diagnosed with a mental health disorder. Peer associations, especially in adolescent years, are considered to be a critical risk factor. This is because during adolescence, teens have an increased attachment to their peers. Social relationships outside peers are important as well. If a child lives in a neighborhood with a high crime rate, they tend to believe that criminal behavior is more acceptable. Because delinquency has been associated with school failure or poor performance at school, school is one of the biggest community risk factors. School policies regarding suspension, expulsion, and school tracking, which is when teachers group children with similar academic levels together, all play a role in determining if youth is put at a greater risk of offending. It's important to note that even though these are all factors, it doesn't mean the presence of one or two will result in delinquent juvenile. The probability just grows more when more risk factors are present. When juveniles enter the system, they usually are required to undergo a screening. This screening typically lasts about 10 to 15 minutes and can be done by specially trained detention staff instead of a licensed mental health professional. It serves 2 purposes: to determine if the child may be at risk to themselves or others, and to identify any juveniles who may need emergency health services. Assessments are used as a more intensive examination of problems or behaviors, and are also used as a tool in determining if a juvenile is mentally competent to stand trial. All costs are absorbed by the state, issuing the screening and assessments unless the family is found financially stable enough to pay. There are a few challenges when it comes to juveniles with mental health disorders. Prevention before youth reach delinquency is best, but not always attainable. Some areas may have a lack of psychiatrists, and many office-based practices do not treat Medicaid patients, which is concerning since mental health disorders are usually 2 to 4 times as likely in children from poverty. For some youth, the only services they receive is through the school system, which the effectiveness of which can vary since there's no best practice model. Some research credit the abundance of juveniles with mental health disorders in the juvenile justice system back to the laws from the 1990s, which limited public mental health services. Parents often requested their children to be arrested because they knew or hoped their children would receive the services they needed if they were locked up. Now, even though screening and assessments are required, it doesn't always guarantee treatment for youth. One survey found only 23% of youth diagnosed with a mental disorder were receiving treatment in Maryland. Treatment, while in custody also poses issues because there is evidence that it can actually worsen. It can have a worsening effect, increasing the likelihood of continued offending and recidivism. There's no denying that some juveniles, for their safety and for others, the safety of others, need to be held in secure facilities. But for others, diversion away from their incarceration into community-based treatment programs could be better for their rehabilitation as well as their mental health. Under a proposed system by Thomas Griso, juveniles would undergo screening and assessment at every critical decision-making process. This includes court intake, detention, admission, court decisions about disposition, and entry into secure juvenile justice programs. Whenever possible, juveniles with long-term mental health needs should be diverted away from the system. In an event a juvenile does need to stay in a secure facility, the juvenile justice system should provide mental health services. When releasing a juvenile, the juvenile justice system should place condition on juveniles, similar to probation, placing adolescents in outside mental health services. For juveniles who are successfully diverted, there are multiple treatment options based on the needs of the specific juvenile. Functional family therapy is a short program involving the entire family of a juvenile who is either at risk or involved in delinquency, violence, substance abuse, or has a multitude of mental health disorders. The National Mental Health Association ran a 5-year follow-up study and found that less than 10% of youth who received FFT versus 60% of in juvenile court had subsequent arrests. Treatment foster care, also known as multidimensional treatment foster care, is an alternative for adolescents who are unable to go home for varying reasons. Participants in treatment foster care have severe and chronic emotional and behavioral disorders. Children are placed with specially trained and supervised families for a period of 9 months while they undergo family therapy with their own family. Studies showed stronger results for boys and girls, but has shown a significant reduction in arrests. Systemic therapy is a family-based approach that attempts to identify causation factors in substance use and delinquency. Studies have shown a 70% drop in rearrest rates and decreases in mental health concerns for serious juvenile offenders. Although there are many different treatment programs out there, these 3 listed are the most effective models for delinquency reduction in offenders with mental health disorders. America has 4 systems set up to take care of the well-being of the country's youth. Unfortunately, these systems usually run parallel to each other and not in collaboration with each other. Some researchers have proposed the idea of all agencies working under one umbrella agency. This would not only allow but encourage each agency to work together since they often serve the same people. At the core, the juvenile justice system's responsibility is to take care of the youth in its system, while also providing safety to the community. It only makes sense that steps will be taken to better care for the mental well-being of the children in their care, which in turn will reduce recidivism and create a safer environment for the community. The end.